The Health Department has formed a task force against communicable diseases like mpox. Health Secretary Ted Herbosa said the task force is composed of experts including Dr. Edsel Salvania, Dr. Ronjean Solante, and Dr. Winlove Mojica. The task force aims to improve the information dissemination about mpox. DOH is also seeking assistance from the Philippine Dermatological Society in setting up a website for online consultations of possible mpox cases. Now, to get more information about this, we have health spokesperson Albert Domingo on the line.
Hey, good morning, Doc Domingo. Thanks for joining us again.
Hi, good morning. Good
Yes.
morning, Angelo and Angela. Good morning, everyone.
Yes, Asec, aside from informing the public po about mpox, ano pa po ang role ng task force na ito?
Yeah, importante dito sa task force natin is setting up the referral system. I heard you mention it, Angelo, no, yung ating collaboration with the Philippine Dermatological Society. Importante yan kasi as we noticed dito sa case number 10, hindi siya nagpakita sa isang emergency room. Nakita siya sa isang dermatologic clinic. So,
That's right.
ayaw naman natin nadadagsahin ng ating mga dermatologists. And the easiest way to go about this is, meron dapat contactless muna. So pictures muna, take a picture of your lesion. Tapos yun ang pinag-uusapan ng task force. Where do we upload it? Is it going to be an app? Is it going to be a website or a number? Where our patients can seek consult confidentially. Tapos pag sinabi ng dermatologist na mukhang kailangan ka mag-testing, saka lang siya magpapatest.
Doc, no, Asec, I'd like to clarify kasi syempre it's mas maganda, medyo streamlined ang magiging processes natin. So ang unang step po to confirm if one sickness is mpox is through the dermatologist muna. Hindi siya pupunta sa isang ER para magpa-blood test.
Yeah, actually the test for mpox is gathering a sample of the skin.
Okay.
So ang sabi nga namin is, ang mga importante dito ng frontliners ngayon will be our dermatologists.
Right.
Kasi sila yung mga sanay dito. But at this point in time, since we are still discussing with them the system, it's best to text them first, no, kung alam niyo yung clinic phone numbers, para mag-guide nila ang ating patients if you have para bang possible mpox na iniisip ninyo. Tapos sila magsasabi kung saan kokolektahan ng sample. For now, we are looking at the major hospitals. The big hospitals with departments of dermatology are able to do the sample collection. It's from the skin.
Yeah, I'd like, last lang before we move on. No? Doc, I'd like to, you said kasi kanina, the moment you think you have mpox, get in touch with a dermatologist. Now, what is that moment? I'd like to ask. Kunyari, I'm a regular person na hindi masyadong updated sa pangyayari, but I know my mpox. How would I get an inkling na meron possibly akong mpox? Kunyari, walang fever or anything.
All right, that's a very good question. No? What will make me think that I need to go? Ito yung mga combination. So symptoms, kung meron kang fever, lagnat, tapos meron ka ring namamaga na kulani, lymphadenopathy sa leeg, sa kilikili, or sa singit, may mga, mga kulani dyan. Namamaga sila. And at the same time, meron kang mga butlig, no? Small vesicles on your skin na nakikita natin. Tapos, kung meron kang history of close physical contact and intimate also. So, if you've been if you've been to parties, if medyo nag-skin to skin, if lately you've had, it can also be sexual contact because skin to skin rin yun, then it's probably a good idea to consult a dermatologist.
Kailan po ba, Asec, ang target launch nitong online consultation and also the website?
Hindi pa kami nagbibigay ng timeline, Angela, kasi it will really depend on whether the systems are ready or not.
Right.
At this point in time, definitely our dermatologists and also the general practitioners, they have their own individual clinic numbers. The hospitals also have their own individual numbers. Pero dun sa parang centralized platform, then yun yung kailangan nating ayusin. Actually, there's a meeting of the task force this afternoon. Other things that we are going to discuss would also be how to proceed with the guidelines or guidance para sa mga establishments like parlors, like barbershops, massage spas, di ba? Na parang sabi nga namin, we don't need to lock down, we don't want to lock down, but we want people to be safe as they continue with these businesses.
That's right. Pero Asec, balikan ko lang po yung mpox case natin na the recent po na babalita. Ano po yung update sa kanya? Magaling na po ba siya? Nasaan na po siya ngayon?
Si case number 10, our newest case, reported last week, he is doing okay. He is recovering in a government hospital. Actually, Angela, ang mpox cases, they are allowed to go home as long as wala silang ibang conditions. They can complete their isolation at home. The only reason why case number 10 is still in hospital, meron kasi siyang ibang conditions we can't disclose because of patient privacy. Pero insofar as the mpox is concerned, he's doing quite well.
Oo. Pero kamusta naman po yung mga close contacts itong meron pong mpox natin dito ngayon? May mga nag-develop din po ba sila ng symptoms? Kasi we've heard also, we've read some reports also na yung iba daw po ay hindi nagkakapag-coordinate.
The best source of information of this could be the Quezon City local government. But based on what they have reported, wala naman silang sinasabing close contacts na nag-develop ng symptoms. You only need around 21 days to complete your quarantine. Quarantine is when you're watching out, you're observing yourself. Ang protocol sa kanila, once a day, they have to look at their whole body, their skin, kung may nag-develop na rashes or hindi. Kung wala naman, after 21 days from the time that they had contact with the index case, then tapos na yung kanilang observation period.
Ito pong may kaso po ng mpox sa atin, yung pang-10 po ito, no? Sinasabi po natin. Pero una pa lang po ito ngayong taon. Wala po ba tayo ibang mga nababalitaan na suspected cases of mpox?
Angela, every day there are around 5 to 10 cases that are tested that are suspect. But the thing is, if we will report all of those, we will cause undue anxiety. Kasi there are many diseases that actually look like mpox. And the only way to determine if they're mpox or not is the PCR test. Imagine if we reported every day that there's a suspect, tapos negative naman pala. Alam mo, two things na magpapanik ang mga tao, number one. And number two, kawawa naman yung mga pasyente na chickenpox or ibang mga sakit, shingles. Kasi magkakaroon ng stigma. People will start, sa Tagalog, mandidire na parang, ay, baka mpox ka, which is the wrong behavior. Parang the correct behavior here is, if you have a skin disease and it's still suspect, don't announce it muna. We know that there has been an LGU na nag-announce. We respect Northern Samar for their judgment call in it. But we hope in the future, magkakaroon din ng para pang evaluation kasi malamang ang gusto ng provincial health officer is localize yung information. Pero in this day and age, Angela and Angelo, if you post something on Facebook and someone picks up on it and someone will aabot yan sa ibang bansa, hindi lang sa Northern Samar. So parang sabi nga namin, this is a choice in this communication. Mas maganda, localize, magpadala ng letters or doon na lang sa barangay. Huwag nang ilagay din sa nationwide na pinag-uusapan natin sa Brunch, di ba?
Oo. Totoo. Asec, kanina nabanggit nyo nga po yung mga businesses like spas and salon na hindi naman po iniisip natin na mag-lockdown sila. Pero paano po yung magiging guidelines po nila doon, yung protocol nila? Kasi yan po ay may mga skin-to-skin contact.
This is very interesting because it's not going to be our first time to be in such a situation. But remember nung bagong labas lang natin sa COVID, around 2022, I remember nung nagpagupit ako noon sa barberia, I stopped cutting my own hair kasi safe na. Pumunta na ako sa barberia. Yung barbero naka-face mask, naka-gloves sila. So they actually have parang memory of how to go about it. Although, hindi na kailangan kasi naalala ko na naka-coverall pa buong katawan yung mga barbero. Ngayon, kahit mag-gloves, naka-face mask, kasi the important thing to remember is skin-to-skin contact. Kung di naman dumidikit yung balat mo dun sa ginugupitan, there is a low risk. Now, what about yung mga masahe? Practical advice. Hindi pa to final, pero we are entertaining the following. Massage therapists can wear gloves. But the thing about latex gloves kasi is you cannot use them with oil because oil will cause latex to break apart. So if you're taking but don't worry because there are other forms of massage. You can put powder. You can have a dry massage, diba? So there are, I think it gets really interesting kasi ako rin, I usually have massages once in a week or every 2 weeks. Ngayon, I'm also waiting and I'm actively helping facilitate the drafting of the guidelines. Para sabi ko, gusto ko na magpamasahe pero gusto ko safe. So gagawin natin yon.
Oo. Alright, sige, on that note, maraming salamat po sa inyo. That was Health Spokesperson Albert Domingo. Thank you so much.